Now introduce our panelists who will be here to address the different concerns raised by parents. We have Ms. Bernadette Alexander, Director, Regulation and Standards, Early Childhood Development Agency. We have Dr. Chan Si-min, Head and Senior Consultant, Division of Paediatric Infectious Diseases, Khoo Teck Puat National University Children's Medical Institute, NUH. Professor Derrick Heng, Deputy Director, Medical Services, Public Health Group, MOH, and Mr. Tony Low, Zonal Director, Schools, E-Zone, Ministry of Education. So if we have different perspectives, I think when we looked at the question, based on the kind of questions that were posed to us, we selected the right panel to come in and address your concerns. Next slide. Let's start off with the one on vaccine safety and efficacy. I think the subcategory that we looked at is in terms of asking what are the short-term and long-term effects and what to do about it. Two key questions which I would like to pose to Dr. Chan. What are the short-term and long-term side effects for children after vaccination? What should I do if my child has mild symptoms like fever and vaccination? Dr. Chan, over to you.
Thank you, Sarah. Thanks for the introduction and for the opportunity to be on the panel. So I think asking for the short and long-term side effects is probably one of the most common questions, and that's very understandable that parents want to understand what to expect. And our data on side effects for children after the vaccine is drawn from, firstly, the Pfizer study, looking at about 1,500 children who received the vaccine compared to 750 children who just received the placebo, meaning just an injection of saline that didn't contain the vaccine. And then more importantly, the US data just came out a few days ago on 8.7 million doses of vaccine given to children 5 to 11 years old. And this is the 4.2 children who are fully vaccinated that I mentioned earlier. And of these 8.7 million doses, what they found actually is that the side effects in a 5 to 11-year-old was generally less than the side effects seen in the adolescents 18 years old. So what parents should most commonly expect is that about 6 in 10 of children who have had the vaccine will have some kind of local arm pain after getting the injection, right? So wherever they've got the injection in their arm, they may have pain, swelling, a bit of itchiness, or a bit of redness, and that can last for a few days. It's generally mild, and it will go away on its own. Less commonly, so in about sort of 3 to 4 in 10 children, will also develop some tiredness, muscle ache, and fever. And actually, fever is certainly not as common as in the older age group of the adolescents and adults. So actually, for the first dose, less than 10% of children will actually have fever. And just addressing the question of what to do if you have mild symptoms like fever after the vaccine, the general idea is to rest, to hydrate, to take some paracetamol if the fever is high and the child is uncomfortable. And generally, these symptoms are transient, so they last 1 or 2 days, and then they go away completely after that. And when they looked at these 8.7 million doses, when you want to talk about the serious side effects of concern and of interest to us, which is essentially the inflammation of the heart, which is myocarditis or pericarditis, in 8.7 million doses, they only had 11 verified reports of these cases, and all 11 children are already recovered or recovering. So actually, compared to the data we have at the moment for myopericarditis in the adolescent age group, the 5 to 11 actually looks as safe or even safer than for the older age group. For long-term side effects, I think it's hard to say because, as you know, the 5 to 11 age vaccination has only just started, so there are no long-term side effects that are known at the moment. But from what we understand of the biology, right, of how the vaccine works, how the vaccine is produced, what we know is that the mRNA vaccine, the mRNA component itself breaks down on its own within a couple of days. So within sort of 2-3 days, the mRNA is completely gone. The spike protein that the mRNA produces does not actually cause any infection. All right, so it's not like the virus where you have a very high load of virus, a very high load of the viral protein, and that causes illness and symptoms. This actually is not that, so it doesn't cause the infection in itself. So we don't have any expectation for long-term side effects that have not already been seen, especially in the adolescent age group. Over.
Yep. Thank you, Dr. Chan. I would want to also ask Prof. Heng if you have anything else to add to the short-term, long-term effects, as well as the next two questions. What government support will there be if my child suffers from a vaccine injury, and what is the intent of the indemnity form? And I think it's a consent form more than an indemnity form. Yeah.
Yeah, I think Dr. Chan has summarized very well the short-term and long-term side effects. I would like to echo her view that actually, if you look at other vaccines, other vaccines also generally have not been found to have any long-term side effects. We do not expect it to be any different for COVID-19 vaccines based on the biology of the vaccine. Right? And I think if one worries about spike protein, then you need to think about if the child is infected, then there will be multiple times the amount of spike protein in the body, right, when someone is infected compared to what is produced by any vaccine. Yeah. In terms of government support, you have heard that the chances of a serious vaccine-related injury like myocarditis that's related to the vaccine is actually quite low. Nevertheless, if that should unfortunately happen, one, of course, the child will be eligible for subsidies under that the government provides, plus MediSave, MediShield, and MediFund. In addition, for serious related injuries, there is also the Vaccine Injury Financial Assistance Program, which actually then provides a lump sum financial assistance to the child. But as mentioned, in terms of the indemnity form, it's actually not an indemnity form, it's a consent form. So no different from the many consent forms that you have signed for your child when it comes to vaccination, when it comes to even out of school activities that the school wants to bring your child to. Right, so it's no different in that sense. So it's no different from other medical procedures like childhood vaccination. So the aim basically is to ensure that the parent has read the accompanying information sheet, so that it's aware of the benefits as well as the potential risk of the vaccine, and makes an informed choice for the child. So that really is the aim, and it's actually not something out of the ordinary that we created especially for the COVID-19 vaccine. Yeah, over.
Thanks, Prof. Heng and Dr. Chan, for that clarification. Maybe I'll move to the next set of questions. And the first one is on the recommended time interval between doses. And two specific questions. I'll be bringing my child for vaccination. Are there benefits if we increase the interval between the first and second dose? Can the second dose be taken more than 21 days after the first dose? Could I ask Prof. Heng to address this?
Yes, thanks. So I think right now, in terms of the experience, from both the clinical trial as well as from the vaccination program rollout, the intervals have been basically a minimum of 21 days. Although, of course, there's some variation. Some people may delay a while, they may take it a few days after. So that's the data that we have in terms of safety and efficacy. But nevertheless, we are monitoring various jurisdictions where if the data emerges about prolonged intervals, whether there are benefits, then there may well be studies underway, and we'll monitor for the studies. And we will adjust our recommendations if there's more data that emerges. But nevertheless, I think the recommendation is that it should be taken as a minimum interval of 21 days. I think based on, again, experience of other vaccines, longer intervals are actually not harmful. But having said that, one needs to consider the trade-off. A longer interval would imply that your child would be at a greater risk of being infected after having just one dose. And we know that actually for full protection, you actually do need 2 doses of vaccine. But in terms of the appointment booking system, right now the system does accommodate appointment intervals of more than 21 days. So you can actually book the appointment accordingly if you want to have a slightly longer interval. Yeah, thank you.
Thanks, Prof. Heng. I think it's good to explain why we are looking at 21 days interval and whether we can allow more than that. I think the second set of questions under this is on the kind of activities, especially with younger kids. It's difficult to control how active they are and the kind of activities they take part in. So the couple of questions on strenuous activities. How do you suggest we manage their physical activities after vaccination? I think it's challenging to control young children from running about and being physically active. And also whether swimming classes are considered light exercises. Maybe I can call Dr. Chan to address this.
Thank you. So, I mean, that's absolutely true. It is very hard to stop young children from running about, on a normal daily basis. And to be honest, that's perfectly fine, right? So normal physical activity at home, at school, running around, playground, that's all okay. When we talk about avoiding strenuous exercise, we do include things like swimming classes, because swimming classes, they maybe swimming a lot of laps, they're trying to reach a certain time for the lap, they're trying to achieve their swimming exam test requirements. So generally, we would say swimming class is considered strenuous, and to avoid that for 2 weeks. Other things that we would suggest avoiding would be things like jogging, the gym, cycling, sort of racquetball, tennis, sort of ball sports. So anything that really is going to, be sort of very strenuous physical exertion, get the heart rate up, and it's kind of outside of ordinary physical exercise and being physically active at home or elsewhere.
Thanks, Dr. Chan. I think that's the broad label of outside of ordinary physical activity they are getting involved in can be seen as strenuous activities. I think is a good way to frame it. The other set of questions that came in are about the booster jabs. What are the number and frequency of doses needed? How long is the efficacy of the vaccine for young children? And do they need to take booster jabs since adults have to do a booster after 5 months? Could I ask Prof. Heng to address this?
Yeah, thanks. I think currently there's actually no recommendation, right, for booster jabs for children 5 to 11. Right. I think having said that, of course, we will be guided by the emerging data and evidence, as time goes by. And in fact, that's one of the reasons why KKH has conducted that study on 150 kids. It's not really to look at the safety efficacy. That has been actually quite well addressed by the clinical trial as well as by the emerging vaccination, real life data for millions of children in the US as well as elsewhere. But rather, KKH is following up the kids, right, for 15 months, precisely because they want to measure antibody levels and to see how the immune system evolves, right, in response to the jab over the longer term, and to see whether there's any waning, right, of immunity. Right. Now, the expectation would be that there might well be some waning antibody levels. That's a natural response of antibodies to any infection challenge. But antibodies goes up and then they go down thereafter. But what we're looking at actually is not just from local data, but from overseas data as well, to see whether what is the real life impact, right, on the risk of infection, on the risk of severe disease, right? And on that basis, our expert committee will then recommend whether or not there's a need for booster jab. This is exactly the same thing that we did for adults. So at the beginning of the adult rollout, right, because there was no data, we couldn't quite predict, right, about the duration and the number of booster jabs. But we basically are guided by the emerging data as time goes by, as scientists all over the world look at the real life efficacy of the vaccine. Yeah, over. I'll address the next two questions as well in terms of non-mRNA vaccines as well as be available. I think the advice basically is that yes, certainly we are looking at making other vaccines available in our portfolio, as we have done for adults. But for kids, looking at the data that's out there so far, I think most of the trials for alternative non-mRNA are actually in fairly early stages. Right, so we do not expect to have good data for other vaccines such as Novavax, for example, for some time to come. Even if Novavax is approved for adults, there's an application pending before the Health Sciences Authority for Novavax, which is a protein subunit vaccine for adults. Right? But even if that is approved, it will take some time before the children data come in. The same as for the mRNA vaccines. Typically, the trial data starts with adults, right, and then they move on to kids. So I think the advice basically, similar, is that one shouldn't wait. I think the basic advice from experts all around the world is that the best vaccine really is the vaccine that's available to you right now. And in the face of an impending potential wave of Omicron cases, I would totally advise that one should not wait and to take the vaccine that's available right now. Thanks.
We have some questions from the live Q&A. Maybe I get Dr. Chan to address. There's this question on, since many children that were infected with COVID do not exhibit symptoms, there is a chance that a child may already be infected or recovered from the virus without them knowing. What are the implications of a child taking the vaccine while being infected or recovered from the virus in the last 180 or 270 days? Dr. Chan, please.
Yes, so the general recommendation is that we do not need to test for past infection, which was perhaps unknown, undiagnosed, asymptomatic, before giving the vaccine. There is some suggestion that actually the best immunity you can have is a combination of natural immunity from having had the infection as well as having vaccine immunity after having had the vaccine. Generally, if we know that somebody has been infected, we say that natural immunity will last you maybe about 3 months before that really starts to wane to a level where it won't protect you. And that's why we recommend that if you know you've had COVID, wait for about 3 months and then you get a single dose of the vaccine. And I think in a similar way, it is not unsafe at all to give a child the vaccine without actually even knowing whether they've had the infection 6 months ago or 9 months ago or 12 months ago.
Thank you, Dr. Chan. Maybe we'll now move on to the second category, where we address more on medical eligibility for vaccine. So we have this group of questions where they talk about the allergies to paracetamol and then G6PD deficiency, and then kids with history of Kawasaki disease, heart condition, and eczema. And also there's also some children who have recovered from COVID-19, whether they are suitable to take the vaccine or will they need to wait for a certain period of time. So can we have Dr. Chan or Prof. Heng to address some of these questions? Thank you.
Okay, so maybe if I address the last question first, which is what I just mentioned, which is that if you have recovered from COVID-19, wait 3 months and then you can have a single dose. And the single dose after a confirmed COVID-19 infection would be considered as being fully vaccinated. For the other questions, I think there is a very long list of medical conditions that people might be asking about. And the short answer is that for all those conditions listed there, they can all have the COVID-19 vaccine. Now, the people who we would say should not have the COVID-19 vaccine are those who have already had the first dose and then develop something called anaphylaxis after it, which is a very serious allergic reaction, which is very rare, where they get sort of eye swelling, face swelling, difficulty breathing, low blood pressure. People who've had the first dose who get skin or other facial swelling within 4 hours of the vaccine, or people who've had the first dose and have had myopericarditis. So all these people who've had first dose and had any of those 3 serious reactions should not go on to have a second dose. The only other group of people who shouldn't have the vaccine are those who are known to be allergic to a substance called PEG, or polyethylene glycol. And this is actually a very common substance in cosmetics and other commercial products. So if you have a known allergy to PEG, then you should not receive the vaccine because that's a component of the vaccine. I think for some children who have serious medical conditions, so for example, if you have an immune system problem, so something that makes your immune system weak and vulnerable, or if you have serious heart conditions, lung conditions, or neurological conditions, where especially you might be needing home medical support, so some children are on oxygen at home or requiring other kinds of medical support at home, these children should discuss it with their doctor first regarding the timing of their vaccination and where they should have it. But other than that, everyone else should be okay to be vaccinated.
Thanks, Dr. Chan. That's very helpful. Prof. Heng, would you like to add?
Yeah, just to add on the issue about safety for someone who's recovered if they're taking a vaccine. Just to say that this is in fact a recommendation that people who were unvaccinated but had the infection and recovered, they should take an additional dose of the vaccine to complete their immunity, right, so to speak. And this has been the case in basically thousands of adults, both locally as well as overseas. So many adults who were previously unvaccinated before they caught COVID have been vaccinated very safely with additional vaccine. And the data shows that it is safe and one dose is effective enough because it's basically considered the infection to be the first dose, so to speak. Yeah. Right. And just to also add to the answer about the serious medical conditions, as I said, that actually in general, it is safe, right, for these children to be vaccinated. The only question regards timing, because in certain kids who are under immunosuppressive medicine, you may want to consult the doctor on the optimal timing, because you may want to time it in between, say, cycles of chemotherapy, for example, so that the body is able to best respond to the vaccine. Yeah, thank you.
Thanks, Prof. Heng. Okay, let's move on to other categories of questions. The next one is regarding children turning 12. So for those who will be 12 in February this year, is it better for him to get vaccinated when he is 12 and take the adult dosage? And another question is, if the child turns 12 after the first dose, and then what will happen to the second dose? We also have a live question asked by Erica. Erica asked why dosage is based on age and not by weight. Are there any implications for kids who are very underweight? So to the doctors, please. Thank you.
Okay, so maybe I'll start with the first question. So the child who's 12 in February, I would say that unless your child is turning 12 in the next few days, I would just go ahead and get the vaccine when you can. And if the child happens to be under 12 at that time, then that's fine. You just have the pediatric dose for the first dose as well as the second dose. And that pertains to the second question as well, which is that if you turn 12 in between the first dose and second dose, the second dose will not be the adult dosage. The second dose will be the same dose as what your first dose is. And I think one of the reasons for not waiting until you turn 12 is because the time between now and when you turn 12, you are essentially unprotected, entirely unprotected for COVID-19 and especially for hospitalization and severe infections. So I wouldn't necessarily wait to turn 12. The last question was about the weight. So essentially for all vaccines, vaccine dosage is based on age and not based on weight. So that stands for all vaccines. And that's also how the clinical trials have been run for all the vaccines. It's to do with the maturity of your immune system, right? And that's to do with your age as to how your immune system matures to produce an immune response to the vaccine to give you sufficient protection. And that's not based on weight, that's based on age. Over.
Thank you, Dr. Chan. So I get the main message is not to wait and also yeah, just don't wait and then get your vaccination quickly. All right, so Prof. Heng, would you like to add on the child turning 12 category?
Okay, so I think for children turning 12, if you get the first dose as the pediatric dose, the second dose will automatically follow as the pediatric dose. Right. So this is, yeah, thanks.
All right, thanks, Prof. Heng. Okay, we'll move on to the next category of question, which is conflict with other vaccinations, because COVID-19 vaccination is not the only one that children take. So there are questions on P5 students who have just completed their P5 immunization program in November, very recently. So is it safe for them to take the COVID-19 vaccine? And also a parent also asked about her child had her second dose of flu vaccine last December. Is it okay for her to get the COVID-19 vaccine this January as well? So yeah, would Dr. Chan or Prof. Heng like to take these questions?
Okay, so the short answer is that it is safe for both of them to have the COVID-19 vaccine. And in fact, in some countries, they give the flu vaccine and the COVID vaccine at the same time, at the same visit. Just opportunistically, they just give both. There is a recommendation that we try to separate the COVID-19 vaccine from another vaccine for 2 weeks, but even that is not an absolute. So in a sort of pandemic where you are seeing a huge surge in cases, and you know that perhaps vaccine supply may also be limited, then I think you wouldn't necessarily have to wait the 14 days before in between your 2 vaccines, right? But generally for both of these, November, December, it's absolutely fine to go ahead.
Thank you.
Sorry, maybe just to add to that, that actually the 2-week recommendation is actually a preference. I think the US CDC has indicated, and also our own expert committee has indicated that that actually it can be taken, vaccines can be taken together. But as Simin, as Dr. Shah has mentioned, in some countries they give the flu vaccine and the COVID vaccine together. But however, where we have the luxury of time and can separate it, then actually giving it 2 weeks apart will enable to tease aside the side effects, so you don't confuse the side effects of one with the other. But I think it's just a preferred rather than an absolute. Thank you.
Thank you, Dr. Chan and Prof. Heng. So we have addressed quite a bit on the medical related questions and concerns. Let's move on to another segment where parents also ask about how about school support and arrangement. So we have Mr. Loh and Miss Bernadette, to help us address some of these. So we have this category on attending school after vaccination, because if let's say they go for vaccination, would the children be exempted from physical education classes, because we say shouldn't have strenuous activity, and can the child attend school as per normal? What do we do if the child does not feel well after vaccination? And what about arrangement with schools if the child vaccination is actually booked on a weekday, a school day? What options do we have? So let's hear from our school representatives from MOE as well as ECDA to share the information about these. Please, Mr. Loh or Miss Bernadette, over to you.
Okay, so maybe I start off first. Right, I think as what Dr. Chan has mentioned, there shouldn't be any or should avoid strenuous activities after 2 weeks of the vaccination, whether it's first dose or second dose. So our schools will actually excuse students from physical activities for 2 weeks. The PE teachers and the CCA teachers will check on students before they start the activities, but it's also good to remind your child to inform the teachers of their vaccination date, all right, and then they will be exempted, okay? But one important thing that I want to stress here is that it is not just within the school. Yeah, your child may have some external activities, like, for example, personal tennis lessons and swimming lessons, for example. You should also inform their coaches, and they should be avoiding those external activities for 2 weeks as well. Okay, so that's generally the point about being excused from physical education classes. The other point is also about not feeling well after vaccination. Well, all our schools are informed that students will be excused from schools if they don't feel well after the vaccination. All right, and if they continue to feel unwell after 2 days, then we would advise that they seek medical attention, and thereafter they can cover their absence with MC. Okay, maybe I pause here for Bernadette to add on.
Okay, right. So similarly, I think for your child is in preschool, I think it's important to let the preschool know that your child's going for a vaccination. So at least they can, and then when the child returns to school, at least they can monitor to see if there's any side effects and anything, they can just take note of the child. Secondly, it's also, they can also exempt your child. They will then exempt your child from certain activities in the school. Sometimes within in the class program, they may have children jumping or they go to the playground within the preschool and all that. So these are the teachers and the center staff can at least take note of your child and then exempt them from these activities. Yeah, I think the other point maybe just to add on here would be sometimes after the vaccination, look at, for as parents or guardians, also look at your child. I mean, if you find it a bit more tired and their arm is sore and all that, I think ensure that they get the necessary rest. And just let the preschool know that if you decided not to bring them to school, let the preschool know that they're not coming to school, in case they're wondering why is it the child not attending school. Just let them know. Yeah, ensure the child gets the necessary rest and then bring them back to school.
Yeah. So on the last question, if your vaccination appointment is on the weekday or during school hours, they will be excused from schools. All right, and schools will help students to catch up with these lessons. Okay.
Thank you. I think it's very assuring for parents to hear all the support and all the support from teachers and school. So yep, let's move on to other school arrangement question that parents ask. That is on school measures. So a lot of questions on whether there will be vaccinated, as in vaccine differentiated measures, like cannot take part in certain activities, or there will be daily testing for students in terms of CCA and physical education or school activities. Okay, then another question on after vaccination, will there be more CCAs and activities organized by non-school organizations, as in those extra additional ones that are not organized by schools, but by outside schools vendors to continue? So please, for your sharing of thoughts, please. Thanks.
Okay, there are currently no plans for us to introduce the vaccination differentiated safe management measures. Right, we'll continue to monitor the situation. Our main focus remains that we want to ensure that our students are well protected. But when the time comes that when we introduce more activities, right, and activities that may be of higher risk to the unvaccinated students, we will find practical ways for them to be meaningfully involved and participate, in these activities. All right, and it is really our priority that we want to ensure that all our students have access to their core curriculum, and also to enjoy the holistic education. Yeah, Bernadette?
Yeah, so just adding on to what Tony has said, similarly, I think for preschools, there are no plans to have vaccine differentiated measures. At this point, I think our key focus is actually to ensure that parents and guardians, you have the necessary information on the vaccine efficacy and safety so that you can make a very informed decision on to vaccinate your child. And I think it's what the medical professionals have added, right? It's important that we protect our children quickly, because given, with the variants and all that, just need to protect our children. So yeah, so I think it's good that if you're parents, you can just look at some of, based on the resources that's been given to you, then make that informed.
Thank you so much, Heng. All right, let's move on to the next segment of the questions on vaccination appointment. So there are parents who ask that they have not received any SMS for their child's vaccination. Can the child still go for the vaccination? And then there are some parents who want to do the booster shot and having the child getting their first vaccination shot as well together at the same time. So is this an option? And also, what happens if the child's vaccination date falls on a Friday? Can I still bring along the siblings for injection? And the last question on this parent asking that he has already registered the 9-year-old son for vaccination on 8 January, very specific, but the sibling walk-in is only from 10 January. So can the sibling actually walk in for the vaccination with the brother? Yeah. So can the panel share some insights on this, please? Thank you.
Bernadette, you want to go first?
Okay, perhaps I'll take the first question. If you've not received any SMS, then you go to the National Appointment System, look under the child vaccine, and then you go to childvaccine.gov.sg, and you can register your interest book for your child's vaccination. Maybe the second question in terms of whether you should take a booster shot alongside your child. I think for your information, actually, the designated the vaccination sites, right? They have actually very dedicated queues for the adults as well as children. And it's just basically to ensure that it's a smooth and safe experience for children. right? So at least children get the right dose, because the adults and the children dosage are very different. So there are dedicated queues there. So my advice is, maybe if you arrange a booster shot on a different day than for your child's vaccine, so that at least when it's time for your child to be vaccinated, you can at least give your child the undivided attention and journey with them, in their whole vaccination process. Yeah. Tony, anything you want to add maybe for the next two questions?
Sure.
Okay.
What happens if my child's vaccination date falls on Friday? Can I bring? I think just now the moderator, Sarah's already mentioned that all our Fridays to Sundays appointment slots are fully booked for the next few weeks. So really, we can't really entertain these. So do consider bringing them on Monday to Thursday. Okay. I have already registered my NIRO. The last questions. I think the answer is that you may want to then register again for a child on the day after 10, so that you can bring your children together. Instead of separating them, because we can only start that after 10, from 10 onwards. Yeah. Okay. Thank you for your understanding.
Okay, thanks so much for sharing. Yep, I think we have come to the end of the dialogue segment, and we have covered most of the questions that parents have sent in, as well as those in the live Q&A. They are quite similar and common. So we have covered most of them, but we apologize if we have missed any of your question or we were not able to cover during this segment. However, we encourage parents to take a look at our resources that MOH, ECDA, and MOE has prepared in terms of the vaccination, child vaccination. So we have shared some of these QR codes and links with you through the slide. So feel free to take a look, and you may be able to find the information that you need from there.